Hi and welcome to Steps to Strides with me, Connor Ratcliffe, and today we're back in a garage gym and we're looking at some potential exercises for balance and proprioception. Now today's exercise is single limb stance but with unstable surfaces, and we're going to look at 3 different ways of making our surface unstable. Now off the bat, we've got to make sure that our patients can perform this with stable surface to begin with, before we can then transfer this across to unstable surfaces. Otherwise, the likelihood is this is going to fall outside of a therapeutic range and it's just going to be too challenging for our patients. So as always, it comes down to not being a good or a bad exercise, but in being an appropriate exercise for the patient that you're prescribing these for. So let's take a look at our first variation of an unstable surface, and that's where we're going to use a towel to make us either laterally unstable or medially unstable. Let's have a look. So to begin with, we're going to look at making our foot laterally unstable, and that means what we're going to do is make sure that the towel's underneath the medial aspect of the foot, so it's going to sit underneath the big toe, underneath the first metatarsophalangeal joint, and underneath the whole medial aspect and medial column of the foot, so it tips us over into more of an inverted position, and that's going to bias the frontal plane stability demand towards our everters. So my perineals, extensor digitorum longus, are going to have to work a little bit harder in this position because I'm being made laterally unstable. So what we can do with this, and what you may have seen in sort of our perineal series of exercises, is that we can also cue active eversion, so we can get the patient to actively push down into the towel, again just to really activate lateral compartment and get those everters and lateral stabilizers of ankle working. Now we can do the opposite, and we can make our foot medially unstable. So nice and easy, once you know how to do one, you can transfer the concept across to the other, and all we need to do in this instance is make sure that the towel is underneath the lateral column of the foot. So it's sitting underneath typically 4th and 5th metatarsals and 4th and 5th digits and the lateral part of the heel. So we're going to push into an everted position, and this is going to make the inverters work a little bit harder, and very similar to our lateral unstable position, when we've got the towel in this position to make us medially unstable, we can actively cue inversion down into our towel, again just to bias that load a little bit more to our inverters. Primarily tibialis anterior and posterior are the ones that we like to target, but again others are anatomically available. So that's our first unstable variation of a single limb stance exercise, and that enables us to very specifically bias in the frontal plane. Now we're going to have a look at another way to do this with the foam roller, and that makes it a little bit more challenging again, and we can also bias into sagittal plane. And again, there's no right or wrong with this, it just depends what you're trying to do, but usually sagittal plane is easier. So let's take a look at it. So we've got our foam roller, and we're going to start with the easy version of this, and this is going to be the sagittal plane challenge. So for this, we're just going to stand on the foam roller, and obviously it's going to make me unstable in the sagittal plane, and I'm going to have to focus a bit more here. Actually, distraction and dual tasking and multitasking actually adds challenge, so I might go a bit quiet, you never know. And again, you can see that even in the sagittal plane, that's a lot trickier for me, but can perform. So now we're going to look at the more challenging element of this, when we destabilize again in the frontal plane. So we're going to change the orientation, of our foam roller. And now this is going to make it really challenging for me in the frontal plane. So let's take a look at it, see if I can do it. Just about. So you can see that this is an advancement and it makes me work quite a bit harder. But again, it enables us to be specific in the plane of destabilization or unstable surface with that advancement on a normal single limb stance exercise. Now I promised you 3, so we'll take a look at the third one, and that's going to be adding a wobble board to this. So let's have a look at that one. So with our wobble board exercise, this isn't sort of biased to a particular plane, this is omnidirectional, and you'll get varying degrees of challenge depending on different wobble boards essentially. Some are a bit harder or a bit easier than others, but this is just going to challenge us in all planes. And if we wanted to make it a little bit harder, then we can change where the foot position is, because it will change centre of mass and it will make us work a little bit harder to try and stabilise. So if you put the patient just lateral or just medial to centre, then that is going to destabilise the board a little bit more and make us work a little bit harder. So again, there is some nuance to this. The foot placement will make a bit of a difference. And with all of these, there are easy progressions on this. The same for our stable surface. So we can, if you watch those videos, use the same sort of modifications. So if we wanted to modify the stibula, we can still. But again, you're adding challenge on challenge here, so it needs to be appropriate patience. And we can modify visual. Ooh, too much of a challenge for me. And then there are some other modifications where I discussed about dual tasking, multitasking, or distraction. So simple things like throwing and catching if you've got a partner, or if you're doing this at home, then we can look at some distraction, throwing, catching exercises, again, just to progress. And these are typically sport specific progressions. So if you're, let's say, playing cricket, for example, and you're having to run, turn, spot the ball, catch, these sorts of things can be quite useful because it trains that dual multitasking ability and hand-eye coordination in conjunction with lower limb stability. So we'll have a little look at it and just see if I can do it. So you can do just simple throw catch, or throw against a wall and catch, and we'll have a go and see if I can do slightly more complex dual multitasking. Ooh, just about, but you can see the difference it makes to the stability demand by adding additional tasks. So that's today's video and today's exercise, which is single limb stance with unstable surface and a little bit of distraction at the end for extra value for those of you who watch to the end.